A wonderful example of how we're pushing the boundaries of advanced analytics. So, Walter?
Thank you, Karen, and welcome everyone. Thanks for the opportunity to address you today. I'm going to talk a little bit today about healthcare. As your evolving center, I'm very passionate about healthcare. I think you're right at the tipping edge of an industry that is in dire need of information. As you'll see, there's lots and lots of data in this industry. There's very little intelligent use of data. There's a lot that is the caregiver, the nurse, the nursing assistant, the doctor, the phlebotomist, take your pick. There's an enormous amount that they need to decide in their head based on their knowledge. And it's very challenging. One of the things that Karen talked about is consumability, and as you think about the center and the analytics and the creative work that you're going to be doing, consumability is incredibly important. Let's face it, technology is cool. But if you don't think about how the technology is being used by the person who you use it, as the deputy talked about, it's almost going to be meaningless. There's so many instances where we talk to doctors and folks and they say, well, if only the doctor used the technology the way we told him to. Well, maybe if you talk to the doctor or the nurse in terms of how they practice, you'd have a different perspective on how you would design your solution. So you really need to think about those things as you're focusing on some of these exciting topics. If I hit the right button, it would. No, we're good. I'm going to talk to you a little bit about the market challenges in healthcare as it relates to information. I'm like Karen, I can't stand still, so I apologize. We're going to talk a little bit about the requirements from an industry perspective and where they see themselves going, because where they see themselves going is light years from where they are today, and groups like this can really advance that. So, when you take a look at healthcare, I'm a little scared to stand up here because I'm not exactly sure who's in the audience. This is an industry that's not hitting to the U.S. population. Right? This is something you read about in the papers every day. The growing cost of healthcare, the quality problems that we have in healthcare. And part of the challenge is the fact that as clinicians deliver care, it's not consistent from site to site to site. Because a lot of it is where you trained and what you learned. It was one colleague of ours that Marianne and I worked with years ago. He always said, I could tell you when a doctor graduated by the drugs they prescribed. Because that's what they were taught, that's what they know. And when you look at the massive amounts of information, it's challenging for these people to continually learn. But you think about an industry where you need to learn, you need to be on the forefront. There are advances happening every day in medicine that these people need to be applying to their patients when they're there. Just a couple of facts. What the United States spends about 17.5% of their GDP, this is 2009, on healthcare. And the reality is, we're not getting our money's worth. There's a lot of challenges out there. If you take a look at the uninsured, the latest numbers say that there's 50 million people in the United States uninsured. That's 1 out of every 6 people. Massachusetts tried to fix that problem. They gave universal coverage to everyone. Part of the challenge is they didn't look at the back end of the problem. It's about the information. You can insure everyone, but if I send the person to a doctor and they refer them to a specialist, and that specialist redoes all the same tests that that doctor did, because that information was not available to them, you just increase the cost. Just somebody different is paying. So you really need to look at the balance of how care is provided. It's not just about providing insurance. That's one aspect. When you take a look at the underlying cost and where it's coming from, it's really coming from the lack of safety and quality that's being delivered in the industry. There are enormous challenges. There was a study done probably 10 years ago now by the Institute of Medicine where they said there's about 100,000 preventable deaths a year caused by lack of information by the caregiver at the point of care. We spend about $2.5 trillion in healthcare, and probably 3/4 of that money is being spent in the acute care and post-acute care environment, which is where many of these errors occur. I mean, think for a second, 100,000 people. That's more than the number of people that die in traffic accidents in the United States. Think of it from a complex systems environment, from a different industry. Think about the airline industry. How many people would actually get on a plane every week if they knew that a 747 went down in Long Island Bay once a week? That's what you're talking about when you're talking about 100,000 deaths, right? You have to start to think about it in that context. The other challenge that the industry has is around, also from an information analytics challenge, is something that they call adverse drug events. So several years ago, I don't have the latest number, there was over 700,000 adverse drug events. So that means you gave me a medication and I had a contraindication from another medication that I was taking. Well, you know, some hospitals are fixing those problems today. Not everybody has deployed what they call computer-based physician order entry, which kind of fixes that problem, that has all the analytics behind it that says, you know, I'm giving you this medication. I need to see this lab result before I actually give you the medication, because maybe there's something that came back. So you can see the challenge from a healthcare perspective and the dire need for information, not data, information at the point of care. It's an industry that's crippled. When you take a look at hospital-acquired infections, that probably accounts for 9% of a hospital's budget. That means an infection that was acquired while you were in the hospital. You didn't show up with it, but you got it while you were there. Now, think about that from a patient standpoint, how that impacts your quality of life. But think about it from a hospital perspective too. If you show up and get a hospital-acquired infection, your length of stay typically goes from 5 days to about 22 days. Think about the cost. In the United States now, they got these things called never events. That means insurance isn't going to pay for it if it's your problem. If you created the problem, if you created the safety issue, if you created the quality issue, government's not paying, you're on your own. So now you can kind of see how this all kind of gets complicated when you're thinking about care and quality and how you can best affect it. So where are we going? This is a statement that came from Bill Frist, very powerful person in the healthcare industry. It's back from 2005. But the reality is where we see ourselves going is we see ourselves not being in an episodic perspective, which is how medicine is delivered today, meaning you get sick, you go to the hospital, but a personalized medicine. So how do we start to get to the perspective that I have a different background, genetic makeup, clinical conditions than Karen? Well, how do we treat the two of us the same? Probably a bad example because we're a male and female, but if you take another male, how do you make sure that we treat one person based on their genetic makeup? It's going to be based on information. This is not going to be something random. You're going to have to take this massive amount of information that exists in the healthcare industry today, in these ancillary systems, the radiology, the laboratory systems, the diagnostic imaging systems. You're going to have to start marrying it with high throughput genomic information. So as Karen said, there are lots of different paths that you can take. Not everything, and we're very excited about the Watson. But when you look at the problem in healthcare, where you need to get to personalized medicine, you need Watson. You need that level of intelligence. But there's lots of things that we can do today in terms of how we start to analyze information. The number of reporting entities that hospitals have to deal with is incredible. CMS, Leapfrog, which is actually an employer-driven initiative about the quality of care and improving the quality of care. It's reporting, but it's all based on analytics. They want you to report one piece of information. You need to mine, thousands of pieces of information to get to that yes or no, I accomplished it. So you might use the word reporting, you might use the word warehousing, but there's an enormous amount of intelligence from a data perspective that you need to mine to get you to that point, to get you to the point of personalized medicine. So how would medicine look in the future? So you've got tons and tons of information today. You'd have to marry that. How would you use the information going forward in the future? So, Karen talked about preventative. So how can I prevent conditions from happening? Not wait till you show up and you're sick. How can I use information that I have to communicate to you that you need to take these steps to improve your health? There's a lot that's going on right now. Companies are giving, little incentives to, go get your general checkup, make sure you get your flu, influenza. Lots of things people are doing to try to improve the preventative elements of it. The other aspect of it is, pharmacogenomics, which is, it's a big word, and I'm not a scientist, talk about titles, but, to simplify it, why does Claritin work for me and not for Karen? Right? Claritin works with 30% of the population. Why? I don't know. Right? But this is what, combining this information, it all gets down to the genomic level and how am I composed as an individual versus someone else? And then you have to tie that together, sorry about that, with some of the other information from a phenotypic perspective that exists in the clinical, because your environment is just as important as your clinical condition. If you live in New York versus Florida, there may be different things. Even though we look the same, there may be things in the environment that are going to make it different. And then finally, how do we use the information to create new drugs, new therapies? when you think about it, and you think about the enormous amount of information that folks need to deal with in this industry, these are complex, diverse, unconnected systems. Even within the hospital, as you can kind of see here, there's lots of data sources that hospitals access. And then you bring up a level and you've got what they call the electronic medical record. There's only about 20% of hospitals that have fully deployed electronic medical records today in the industry. So a lot of people are dealing with the actual individual. And you might say, well, how does that impact quality? How does that impact information? Well, think for a second. Thomas J. Smith, T.J. Smith, Tom Smith, is that all the same person? I'm going to be treating this person. I'm going to give him a drug. If I'm dealing with all these individual systems and that's where I'm sorting the data in my head, how do I make sure that's the right person? Right? I mean, those kinds of things seem simple, but they're a problem in this industry. And it's all based on information and analytics. And then you bring it up a level and you start to aggregate both within the hospital as well as within the community. We did a project when I was at IBM. I spent 26 years at IBM and did a lot of work there in what they called information-based medicine, which is these advanced analytics. And we did a project with New York Presby, and we were talking with one of their regional hospitals about something simple like, I'm going to refer you to somebody. And one of the challenges was communication and access to information. So I refer a patient up to Mother Presby, so to speak, the big flagship academic medical center. And what the doc said was, I'm a local doc. I mean, you think I'm in New York, I'm not local? Well, guess what? I run into these people in the street. I know who these people are. I see them every day. And when I run into this person's wife that I just referred, and I say, how's your husband doing? And she says, he passed away in Presby. No sharing of information, no access to information. I mean, it's a very, very difficult challenge. And then you start thinking about all the ancillary, the pharmaceuticals, and all of that. It's not an easy thing. Karen talked about the volume of data, and I don't know, Karen, if you've got updated numbers on this, but back in 2009, they predicted that by 2010, 30% of the world's information was going to be medical information. Just think about that from an analytics perspective and what I'm describing and the lack of access, the lack of intelligence. It's a very challenging industry, but the opportunity is there. The other thing you need to think of from an analytics perspective is, Google. I mean, think about Google and the kind of analytics engine they've got behind there. When you put in, Walter Brzezinski and you find 8,000 hits, they can kind of be wrong. We can't kind of be wrong in healthcare. We're dealing with people's lives. When we're mining information, when we're presenting information to caregivers at the bedside, we can't be wrong. We have to be correct because they may use that information to treat a patient, and it could have pretty significant adverse events. Dr. Gawande is a surgeon that wrote this book that talks about, how do we kind of simplify things? How do we make sure the right thing happens each time, every time, at the point of care? And a lot of that is based on information. Based on certain conditions, I'm going to send you a certain message. And as the chief said, we're not going to tell a doctor or a nurse how to practice medicine, but we need to give them better tools to help them practice medicine. We're not doctors, right? We're informaticists. We're trying to provide information at the point of care to make it better for them as they're dealing with patients. So what does it look like? And I apologize, I'm speaking quick. If you have questions, just stop me, but I know we have a little bit of a time gap here. So what does it look like at the point of care? In healthcare, we get very excited by 1970s grocery store information, right? We're deploying barcodes for med administration. And don't get me wrong, it's a big thing. It's needed. It's 1970s technology. This is not, we get all excited. And when you take a look at this picture up here, this is a picture of a nurse. And we've made major strides in healthcare in terms of information. But put yourself in that nurse's position. I'm going to strap one more thing on you. I'm going to give you one more piece of data. What's your answer going to be? No mas. I can't take it anymore. Because the little red circle on her head, there's still an enormous amount of that information she's processing at the point of care without the help of that technology. And this is just an example. On the right-hand side, this is what the nurses carry around. So I don't know if any of you are familiar with how familiar you are with healthcare, but there's an organization called HIMSS, the Health Information Management Association. And basically they rank the adoptability of technology in hospitals. They call it HIMSS Analytics. And stage 1 is basic information, stage 2. Stage 7 is paperless. That paper on the right-hand side is from a stage 7 hospital. You show me paperless. They're not only printing information out at the point of care, they're writing on it, because even what they're printing out isn't enough. So as you think about these solutions, this is the point about not just the what, it's the how. You have to think about the application, the use. And this is an industry that's dying for your help. This is actually another real chart. This is, so not only do I have all this strap mapped onto me, these are the suite of applications that every hospital is dealing with. So not only do you need to figure out what's going on, you've got to master this maze behind you, which is no simple task, let me tell you. It's very challenging that folks have to manipulate this information as they're going through this. You know, and Karen talked about the warehousing and it not being a fun term, but think about, I've got to aggregate all this data. Right? Remember the example I gave that said, how do I know that T.J. Smith is Tom Smith, is T. Smith? Well, you need to figure that out in the process. And then we worked with a hospital several years ago. It's a chain of 16 hospitals. They had 72 different names for the same test. You've got to factor that in, right? Because you want to make sure that everybody's looking at the same thing. 72 different names. So taxonomy is an enormous, enormous thing. And then forget about physician notes, nurse notes. The unstructured text is enormous. So you have to put that in too, as you think about it. So as you can see, the opportunities are endless in the healthcare environment as you think about information access and monitoring. So imagine, if you will, for a second, that you get all that stuff behind you, all these things. Well, what if you could just kind of walk into a room and, you know, the room knew who you were, and based on that, it pushed information to you, and you could just walk up and you got all the information you needed, you knew the context, it knew who you were, it knew you were a nurse versus a doctor, so it pushed that information to you. And remember the chart with all the writing? What if I told you what you needed to do? Not how to do it, but what you needed to do. You need to turn and reposition this patient now because you haven't done that in 2 hours, and that's a standard of care. You got to turn and reposition patients who have skin, you know, skin-related things every 2 hours. So think of that concept that, you know, as you use information, and again, some of this is not complex data mining. Some of this is informatics and analytics at a very simple level. How do you push the information? How do you get information? Here's an example of, you know, pushing information and not only telling you that you need to walk in, I tell you what information you need to know about a patient, but I can also tell you what tasks you need to do. Kind of see like big, simple iPad. If I showed you what an EMR looked like, you probably will run out of the room in terms of complexity, what the chart looked like. But I told you what to do. I made it iPad-like, so it's easy to document and chart the things. But I also used the information that kind of looked across all your patients and said, you know, you're in room 1, maybe you'll go to room 2. Maybe the patient in room 6 needs you more from a safety and quality perspective. So why don't you go to room 2? And oh, by the way, you need to do a glucose reading when you go to room 2, so you're going to know, let's pick up a glucometer on the way. Not get there and then come back and then have to go back again. So again, it's trying to use information for what information does well. Pushing and guiding people. You remember that chart that showed all those applications. Well, what if I can synthesize all that information down? You know, the biggest challenge about a patient is, when is the patient crashing? Not when they crashed, because you know that. You don't have a problem. When something happened and there's a significant event, you don't need to worry about that. Forget the information. It's going to be evident that something's bad. But what if I could start looking at information and predicting when something's going to happen? So you can see here, this is a company called Rothman Healthcare Index. That actually starts to look red, yellow, green. I can start to, and what they do is they mine 26 pieces of information. So you don't have to think about the lab result as it relates to the weight gain, as it relates to the latest test. You know, this gets together and pushes the information out there to you. Also, from a very simple perspective, from an analytics perspective, you know, nursing. You know, there are nurses out there that, you know, sometimes you've got patients who just are very, very sick, and they take more time than other patients. So what if I can start looking at information to say, gee, it turns out every single day between, the time is up there, you know, 11 and 12, I have a spike, and I need to reallocate my resources because my patients are not getting taken care of the way they're supposed to. And what if I could drill down another level and say, you know, Patrick is just swamped. He's really only taking care of 2 patients. Right? But I can see in the system the workload because I know what tasks are getting done. I know what tasks are not getting done. And I can reallocate nurses. I could say, hey, go help Patrick, right? Because it looks like, you know, looks like Marion's not, you know, not that she's not busy, but her patients aren't as sick. And that happens every day in a hospital, right? So how do you use information? I think I have to tell you to hold your ears. I'm going to try to go by this quick. Thank you. So again, another example of information. You're going to say, you know, why is an anti-wandering patient, you know, where's analytics involved in that? You know what? Maybe the patient's got dementia. Maybe they get too close to an exit that they shouldn't get to. Maybe they go out on a roof in the middle of the winter and something very bad happens to them. Well, you could use information to tie these various things together. I know where the patient is. They're showing they're a dementia patient. I know that because I have access to the clinical information. So I can marry that together with their location to the fact that they're standing right in front of an exit door. Well, I could send a transaction off to the security system and say, lock that door. I don't care that they're close to it. I'm going to physically prevent them from going out that door. So you can kind of see that it's not all about the genotype and the unique individual. There's a lot of opportunity for information in healthcare and analytics to improve quality of care and patient safety. I'm going to skip this. There's a lot of things you could do around. We talked about hospital-acquired infections. Number one problem for hospital-acquired infections is you don't wash your hands. Pretty simple thing that you think, and everybody knows they need to do it. But if you had systems that can, again, identify where you are, determine that you're walking into a room, see that you're not washing your hands, communicate to you that you should wash your hands. I mean, it seems so simple, but it's amazing how bad the compliance is with hand washing in hospitals. And you don't want to know how they track it. It's so manual. And then, you know, the impact on patient satisfaction. Hospitals moving forward are getting paid on how well their patients are satisfied by being in their facility. So there's going to be a financial impact from an information standpoint in terms of them not having access and getting to this data. And then finally, you know, this is what Karen talked about. It's, you know, analytics has multiple layers. It's what happened. First, that's the first thing. I mean, it may be boring, but you need to know what happened. Then what you need to do is figure out why did it happen. That's where the analytics gets a little bit more fun. But then how do we predict it and prevent it? And it's the closed loop back into the information system at the point of care that you have to bridge that to. Again, we're not trying to practice medicine. We're trying to help provide information that's relevant to that individual patient that's going to change the way that clinician cares for that patient. I mean, these people are all trained. I mean, they're going to use their own judgment, but without the information, it's going to be only their judgment. With the information, at least we have a fighting chance. So, with that, sorry for the speed, but thank you.
Okay, we'll get set up for the panel. I'm pleased to introduce Marianne Cooper, Managing Director from IBM. If you can take a seat in the panel, Marianne. Is Dr. Campbell here? Oh, yes, okay. Dr. Murray Campbell, Senior Manager of Business Analytics Research on the panel. Dr. Stellick Barry. Thank you. Professor Katsumakis and Professor Nagaraja. Kevin Fornan here from IBM is going to moderate the panel discussion. He'll take over. I just have an announcement. The center also engages students. So we have, I just want to announce the names. We have 2 student fellows from the undergraduate Gabelli School of Business. John Ketchum, are you here? Yes. Okay. And Matthew Kennedy. So they will help, they'll participate, they'll get experience, but also the fellows will work on specific research projects and support the center. From the GPA, Mita Menezes, are you here? Mita? Just disappeared. Abhishek Mehra? Yes. Okay. So Kevin?
Thank you, RP. And I look out into the audience and I see so many familiar faces. I'm delighted that you're all here. Well, let's just checkpoint here for a minute. We're here today to talk about analytics and the need for skills. We've heard about healthcare, we've heard about policing, and what's common to that? It's the common denominator is the availability and usability of data and information to be more effective, make more effective decisions. We want to be able to cultivate a skills pipeline to take these jobs of today. When many of us started years and years ago in the IT industry, the back office applications were most key, billing and inventory control. We're beyond that. We've gone well beyond that. Thank God we have people on the job like, by the way, Ruben, why don't you join us on the panel? Because this is going to be conversational. This is not going to be just a panel. We'd like to invite questions from you. But Dean Donna talked earlier about technology being organic. and transformative. I mean, could any of us think 10 years ago, 20 years ago, 30 years ago about the transformative effect of technology on policing or on healthcare? We probably knew that it was required, but we didn't know how the heck to get it done. Well, it's getting done now. IBM is a company we're celebrating our centennial year, 100 years in business. We started with meat slicers and scales. We've transformed a few times. We've gone through mainframes, we still have them and so forth. Our North Star now is Smarter Planet. We're out of just the back office, not just us, but every company in the IT industry. We're out of the back office. We're into the Smarter Planet area. Smart healthcare, smart transportation, smart banking, smart telecom. So we need, as an industry, skills. That's the boundary condition to our growth, quite candidly. And so the reason we're talking here today is educators, and by the way, as students, so we're glad the students are here, as business people, as people from the public sector, we need to collaborate together. And it's not just IBM. We need to collaborate with Accenture, with Oracle, with people in our industry. And as you think about all of the areas, I'm looking at Dean Donna and thinking of the business. We've got great accounting. She's an accounting expert. We got people great in finance. So we know assets equal liability and net worth. We got economists here, so we know the factors of production as economists would look at it, or monetary and fiscal policy. We know the 5 Ps of marketing. Well, the IT people used to be just, a single vertical-based organization, and they were sort of the geeks. We now believe, and I hope that all of you would subscribe to that IT is a horizontal tool set that cuts across all of these different disciplines. So the need for multidisciplinary skills is paramount, and we're seeing it now in healthcare, policing, and so forth. So we've introduced the panel. I'm going to start it off with one question, but then I'm going to impose on all of you, and I'd ask the students in particular to ask questions, and faculty of our illustrious panel here, because I think the conversation we had up till now hopefully has generated some curiosity on your part. But I was reading the Times not too long ago, and Thomas Friedman wrote in the New York Times that globalization and the information technology revolution have gone to a whole new level. So that to get into the middle class now, you have to study harder, work smarter, and adapt quicker than ever before. Many good jobs still exist, Friedman observes, but they require more education and technical skills. Friedman's conclusion, we have a skills problem. We don't have a jobs problem. I know we're unemployed at 9% or more, but we have a skills problem, is his key point. So what I'd like to do is invite the panelists to sort of give us their impressions of that. What's their observation? Is the skills problem getting better? Is it getting worse? Is it staying the same? Where will we be 5 years from now? And what advice would they have based upon their experience, either as educators or as business professionals or as police executives for the students here, and to provide advice to the faculty as well. So let me ask Mary Ann, if you don't mind, would you please start us off?
I'd love to. Thank you. Is this on? Can you hear me? Okay, great. So just one quick data point to address exactly what Kevin asked. The U.S. Bureau of Labor Statistics has predicted that...
Is that better? Okay.
Yes.
That the U.S. Bureau of Labor Statistics has predicted that there'll be a 24% increase in the need for professionals with management analytic skills over the next 8 years, and it's only going to compound as we continue to see how the world is transforming. And when Friedman talked in his new book about where he went from the world is flat to where he's focusing on now, when he wrote that book, Facebook wasn't even in existence. So there's this massive convergence of channels of data, of opportunities that companies focused on, specifically growth, given where we've been over the last 4 years from an economic standpoint, that this requirement of the people they want to bring into their organizations to help them on this transformation journey have got to have a totally different set of skills than what they have today. It's not about walking into a job and being given all of the facts and original type of tasks that would just be educate based on the business you're going into, whether it's retail, finance, accounting, etc. It's now, what skills do you bring to the table that would differentiate yourselves from the global workforce that's available to all these global businesses? So it's how do you have the skills to look at trends that are out there today and be able to, bring outcomes for your company based on what your market trends are looking like. How can you take a set of information across disparate groups in a company, different brands, different geos, and look at what are the outcomes that you need to think about as you build some of these new product sets. How do you be able to be more predictive in the type of information that you need to gather and then be able to create transformative growth models for businesses as they look at where they want to be over the next 5, 8, 10 years. And it's all about being more collaborative, knowing how to work in a team environment, but also being able to take the data that's out there and look at totally different models than you've ever been, and being creative and innovative and thinking outside the box. And these are skill sets that I think, part of what this announcement today is about is providing that at a undergraduate level and a graduate level, and that marriage of business academia is so critical as we move forward, because without it, at least from the US standpoint, we will be left behind. And I have the opportunity to travel around the world. I will tell you, the GMU, the growth markets out there, China, India, Malaysia, Thailand, you name it, they already understand this and are really preparing their young workforce to be able to think in this way. And it's all about this data and leveraging and unleashing the power of all this data and being able to collect exactly what Chief Beltran did at the NYPD, and being able to let people get outside their domain and their tower of this is mine, I own this, and really thinking way above that to how can you collaborate and bring all of this information together and make it an asset for how you think about growing and maturing and transforming your companies.
Thank you, Mary Ann. And so the Fordham Center for Digital Transformation will provide opportunities like that for interdisciplinary education, for research, to work with the private sector and public sector, to provide students internships and so forth, to work on those kinds of transformative skills necessary for them to be successful. Let me move on to Ken. Now, Ken happens to be an executive now with IBM, but he's one of the executives who was recently brought into IBM's family. As Karen said before, we spent probably $30 billion on 116 companies over the past several years. One of the premier companies that we have been fortunate enough to join the IBM family is SPSS. And Ken has been a member of SPSS for about 30 years.
Yeah, 30, 20, who's counting? But yeah, it was 29 at SPSS and now a couple at IBM.
Well, I know you didn't graduate college last year.
Yeah, that's a predictive analytics, right? Easy guess. One of the other reasons I'm here today, I think, is because in addition to my IBM SPSS hat, I spend some of my time teaching predictive analytics at the University of Illinois in the Chicago campus, and recently started launching a new program, a Master's of Predictive Analytics at Northwestern, that I'll be teaching in the coming year, that just started this term. And one of the things that actually I'd like to kind of pull some of the, what I assume are young enough people in the audience to have recently graduated, that it's my experience in the last 4 years I've been teaching this data mining for business course in the business school to students who are getting a master's, most of them getting a master's in predictive analytics, MIS. And they take this as probably the last course typically before they go out on the job market. So I talked to a lot of them about their job prospects and interviews, and many of them have mentioned that their background in IT has been, one of the reasons they've been interviewed for jobs. But the fact that they have a little understanding of the analytics and data mining aspects has given them a real leg up in the job interview process. Because employers, and I do a lot of work with companies as well in my other roles, so I observed this firsthand, but companies are looking for people who can cross those silos, who understand data, and those of us who do predictive analytics, we use data in a very different way than used for reporting. And sometimes somebody who's a good DBA might not appreciate our needs for data and why we have we come in on Tuesday with one need and on Thursday it's something quite different. So come back when you get your act together, right? Well, that's not how our business quite works. And having people with a strong IT background but who also understand a little bit about decision trees and neural networks and the world we live in is, I think, a very powerful thing. I'd like to panel here, but I'd like to hear from some of the recent graduates what their experiences have been in terms of the request for analytical skills, predictive analytics, data mining, that kind of thing when you're out in the job market. Because that's where I think education needs to move.
Thank you, Ken. I think the placement rate, I'm looking out here, I know there's representatives here from Hofstra, from CUNY, from PACE, from NYU, from Fordham, and so forth. The placement rate for students who have IT skills combined with business, think of a T-shaped individual, is pretty high. So for those students who are in the audience, all we can do, I think, as a team here is to encourage you to be focused on whatever area of discipline you might have. If it's business, that's great. Biological sciences, policing, but couple it with the information technologies to complement it. So with that as a backdrop, let me turn it over to one of our faculty members at Fordham and ask her to share her points of view.
Good morning. Sort of build on what the other two panelists have said. As a statistician, I'm always really excited when people go and study math and statistics. And I find that not enough people in the United States are following those career paths. And one of the things, just to give banking as an example, we've had a recent financial crisis, and I feel like a lot of it is based on the fact that people didn't understand what uncertainty and risk meant in the real world. And that's a basic component of a statistics education. And I feel like those of you who are going to study and go on in business careers, getting that type of understanding is crucial in order to make proper business decisions, because as we see, decisions that you make in your own company can have very big ramifications across society. So yeah, go statistics, please study statistics, and you'll find that your career prospects will increase dramatically because there's so much need for that type of knowledge, and being able to do the math and being able to communicate those skills and those techniques to others in more simple language. Because statistics can be very technical. A lot of math, a lot of people don't understand all of the complex analysis that goes behind it, but if you can explain that in plain, simple language and make people understand this is why these techniques are important, I think you've got a great career ahead of you.